Have you ever been concerned that you or your child might have a bleeding disorder? My name is Jonathan James, and I am excited to talk to you today a little bit about von Willebrand's disease and invite you to an exciting event that we have coming up right around the corner called Advancing von Willebrand's Disease Management on July 16th. And you can go and register for this free event. It's going to be an educational opportunity where you can learn through breakout sessions from experts such as doctors and physicians and lived experience experts who've been living with various types of bleeding disorders their whole life, to learn more about what bleeding disorders are all about and how to live your best life, how to live a successful management of a bleeding disorder diagnosis. And you can do that right by going to our website at hope-charities.org and register for this free event, and we'll send you all the links so you can jump in and be a part of it. Today, I'd like to bring on a special guest to talk a little bit about her experience with living with von Willebrand's disease. And that's Ashley Dibenedetto. It is great to see you today. Thanks so much for joining me for the pre-event podcast.
Hi, yeah, thanks for having me.
Well, I'm excited to talk about this topic because it's one that has been near and dear to my heart, as we have so many people in our community that have been affected with various types of bleeding disorders. And oddly enough, von Willebrand's disease is well known to be a potentially very common bleeding disorder, one of the most common, but it is, because there's so few people that have been identified, diagnosed, and treated, it still is very difficult oftentimes to get a correct diagnosis. And then the treatment seems to just go through lots of ebbs and flows and changes. And so I'm looking forward to learning more about your journey and also how you got diagnosed with this bleeding disorder. So why don't you start off with telling us a little bit about where you're from, how you're affected, and really how you found out that you had a bleeding disorder.
Yes, yeah, absolutely. So I am in Georgia, and I was diagnosed when I was 11 years old. I'm 35, almost 36 now. So I've been on this journey for a while. And like a lot of girls who don't know about their family history, it started for me with my menstrual cycle. And yes, at age 9, I had a menstrual cycle. So lucky me.
Wow.
Very, very early. So, it was heavy, it was long, and the doctor just brushed that off initially as, things will change. It'll even out. So interesting story. We didn't know about any family history at the time, but we actually had neighbors who had kids with von Willebrand's disease. So, and my mom cared for these kids, would watch them after school and stuff. So we were a little bit familiar, and their mom suggested, oh, well, why don't you get her tested for von Willebrand's? So we finally did get the orders for testing from, I think, my pediatrician at the time. And for whatever reason, I didn't actually get the test for 2 years. Not sure why, but so 11 years old, I was tested. And of course, it was positive. There's indication I had type 1.
Wow. What a great example of what it's like to also have neighbors that have experience with this, to be able to raise a flag. We've heard of lots of stories. One of the reasons why we do interviews like this is really just to, elevate the awareness, because sometimes just, you don't know unless you know. And so that's amazing. What a divine providence that you had, a neighbor that could even clue you in on what was potentially the problem. That's amazing.
Yes. And it all made sense when, of course, your parents get tested then, right? Okay, where did this come from? Where is this acquired, or is this genetic? And sure enough, my dad was the one who had it. And it made sense because as a kid, he had severe nosebleeds, which in males, that's commonly how it presents. Also females too, but somehow I never, ever have nosebleeds. I'm very lucky. But anyhow, he did very, very bad as a child. So that made a lot of sense once we learned that.
Wow, that's crazy. So age 11, you get diagnosed, you find out that this is the problem. Did you get on treatment right away? And how did that go?
Yes. So I was referred to the Hemophilia Treatment Center, which is Children's Healthcare of Atlanta for me. Excuse me. So we did work with that team to figure out what sort of treatment plan I would need if I were to have surgery or an emergency or anything like that. There is the DD-AVP challenge that most people will go through just to see if that medication works. Excuse me. I'm so sorry. So I started to work with that team and figure out kind of what needed to happen from there. And things were a lot different back then, right? So
Mhm.
they told me, you can't play softball anymore. You can't go to PE class anymore. That's
Mhm.
not true. That is not the way that it should be handled. But so things were different and changed a little bit back then.
Wow. Was that hard for you as a child just to learn that I mean, that's got to be devastating just learning that you can't be with your peers and do the activities you probably were doing before, right?
Yes, yeah, it was. It was really interesting. And of course, eventually we figured out like a happy medium and what was allowed. But back, sorry, back then, like prophy wasn't really a thing back then. Now it is. So like now with my son who has it, they're talking about if he wants to play this sport and that sport, we can do that. But back then it was just kind of trial and error of medication, and um, we really didn't find a great medication that helped with my menstrual cycle, aside from
Mhm.
eventually birth control. But at 9, that wasn't really something my parents wanted to go down that road, or at 11, I guess at that point, wasn't really a
Right.
road my parents wanted to go down.
Of course.
Actually, I'd like to say this for any parents watching. My father's personal decision was not to allow me to be on birth control just because of his views until I think I was almost 17 years old. And boy,
Wow.
was that a struggle, right? Because once I was able to be on it, it made the biggest difference in my cycle.
Mhm.
So that's a huge helper for a lot of people.
Mhm. Absolutely. So later on, you get married and you're living your best life, get into your career, and start thinking about a family of your own, right? Did you have any hurdles or challenges that maybe that caused some decision making to you to have to face during that part of your journey?
Yes. So there is a 50% chance of any children I have inheriting the von Willebrand's as well. So I knew that going in. I knew that there wasn't necessarily so much risk during the pregnancy itself, but delivery. So that was always a concern. And unfortunately, at the time, I wasn't going to a hemophilia treatment center. So I wasn't I don't think personally, the best care I could have been.
Mm.
So I wish I had that during pregnancy. But so there were some considerations. I knew if I had a boy, for example, and we chose to have him circumcised, like we couldn't do that at birth.
Mhm.
But also I knew I had to have special considerations for delivery. I didn't know about some of those until closer to delivery. So one thing that some women may not know is you may not be allowed an epidural during pregnancy or during delivery
Mhm.
if that's something you want. That's because there's a risk of a hematoma forming. So it comes down to the anesthesiologist and their team's decision on what can happen. So for me
Mhm.
personally, that is the plan that I had. My hematologist had cleared me for that. And I have kind of a special circumstance where my levels didn't rise to normal during pregnancy, which most people with Willebrand's do. So
Right.
I was told at a conference by one of the hematologists that's like a 25% or 1 out of 4 will not have a stress response. So
Wow.
a little bit different of a situation, not to scare anyone out there. But anyhow, they did not allow me to have an epidural, and that left my options being a vaginal delivery with pain meds, but no epidural, or planned C-section under general anesthesia. So
Mhm.
for me, I just knew I couldn't do it with just the pain meds, so I didn't want to go down that path. So I did have to do the planned C-section, which had a lot of emotional challenges, especially since I didn't learn this until almost the end of pregnancy.
Oh my gosh, wow. I don't blame you. Hey, look, no judgment here. I'm thinking like give me all the pain medicine that to go through I couldn't even imagine what that would be like facing that. So I'm with you on that. I would have done the same thing, but I'm sure that was scary and a lot of uncertainty in that. I one of the things that I think that we found that's common is that people have to change their treatment plan oftentimes through different life events. And so, did you find that you had to move into maybe an injectable medication during that time versus just a, oral form or something like that?
So I had, fortunately, had surgeries previously in my life, so I knew that humate P factor worked for me pretty well. So
Mhm.
that was the plan, kind of going in to my delivery. But again, in my opinion, I wasn't under the best care, didn't have the best treatment plan. So even with pre-treatment, I still hemorrhaged after, had some challenges there during my delivery, or technically right after my delivery. And then later on, I don't remember how many weeks after birth, I had some challenges too. We had to kind of figure out how to treat and what medications as well.
Mm-hmm. Yeah, I know that can be sometimes a big hurdle because you've got all kinds of decision making going on about the surgery itself, and then on top of that, you might have to change your treatment plan and navigate and correlate. It makes me think about, just like you've said, just not being under the best care, and then realizing there's other treatment options, maybe through an HTC. Is there any advice that you would give anybody that's kind of going through these different things and maybe trying to discover what's best for them? Any thoughts that you have as far as what you would say to encourage people to as they navigate these challenges?
Yes, education is so important, and I'm still learning all the time. I've learned a lot more after my son was born, and like I said, he was diagnosed as well. So some of those things include, being involved in groups and communities like this, but also making sure that you do know what an HTC is, right? I didn't know what that was for a long time. Hemophilia Treatment Center, they specialize in bleeding disorders. It's a hospital. They're all over the world. It's not just in the US, but excuse me, they have teams that specialize in that. So typically a lot of people will go to a traditional hematologist that also focuses on oncology, right? That's usually their primary focus. So they're not as well equipped to deal with the specialization of bleeding disorders day to day. So you can look that up. I know if you're in the US, you can look at the CDC website to find an HTC, or just do a search for HTC near me. So the difference there is, like I said, they specialize, but also you have ongoing care. You can call them, you can message them. They're going to manage your care ongoing versus how some of the other types of physicians will manage it.
Yeah. Yeah, it can be really challenging. And I know even the mental health part of the journey is sometimes just takes a lot of support from your friends and family, neighbors, all of the different people in your life. And sometimes you get good advice, and sometimes you don't get as good of advice. And so, I think it's one of those things that you have to be aware that staying plugged in and getting the education you need is so vital from the right sources. Knowing who the source is that you're getting that advice from, right?
Yes, exactly. One of the things that I was fortunate to be able to go do is the NOW conference in Arizona. And that was very educational. It's a great opportunity, but there's a lot of different conferences, a lot of different resources, but definitely, like you said, you want to make sure it's coming from from a good source of information.
Yeah. That's one of the reasons why we do these events, like we're doing on July 16th, is it's an opportunity to be able to hear from experts in the field that are physicians and clinicians that really understand the research and understand the background and treatment options. And but you said it earlier. I think it's such a great reminder that not everybody knows that there is such a thing as an HTC. And just because it says the word hemophilia up front, sometimes there's some confusion, but it really is important to plug into the expert sources, because that is really where you're going to get the best care and the most expert advice. And also just to educate yourself, right? You have to be a life learner when you're living with a bleeding disorder, or your children are living with bleeding disorders, because there may be information out there that, if you go in for an hour visit annually to your HTC, even, there's only so much you can cover in an hour, and there's a lot of priorities there. So, being able to self-educate is important too, right?
Yes, it is. And I know there's a lot of also like local bleeding disorder chapters. So for me, that would be Hemophilia of Georgia. They've been a really great source of information and education. I recently had their outreach nurse come out a few months back, I guess it's been, and teach me to self-infuse, which is just amazing. So now I know how to do the whole thing, right? Take the needle,
awesome.
Make sure I can, get my medication. And it's very freeing knowing that. Another topic I wanted to mention was knowing about the copay assistance programs, because especially factor medication is very expensive. And a lot of these assistance programs out there will help close that gap between whatever else you would owe outside of your insurance. So that's been amazing. But learning how to obtain factor at home, they call it brown bagging, right? If you have factor at home, you bring it in even to a hospital, or for a procedure, you can do that, or you can learn to infuse at home. Very, very freeing.
Yeah, and you brought up a huge point with the financial assistance piece. There is so many resources out there, and just because one door is closed or you attempt to approach one door doesn't mean that every door is closed. But that does take a lot of you. You have to become really self-educated into what the resources are. But like you said, the nurse care coordinator, your clinicians, your HGC is the best place to start, because that's really where you're going to get the most the most resources there in those places. So I'm so encouraged by your story. When you think about the future, and you think about your family and just even your own health, like, how do you feel about the future? Do you feel hopeful because of what you've learned and what you're empowered to do, or do you feel more worried or fearful about the future?
I feel hopeful. I have more recently been introduced to a lot of different organizations and resources too, that I like yours, right? That really are trying to educate people and make people more aware and help them understand what resources are available and how to advocate for themselves. So that makes me very hopeful. So another thing that just popped into my mind is thinking about something I learned, which is like how it can affect your joints, right? So even if you have an injury, so I don't have joint bleeds personally, but if you have an injury to a joint, you can continue to bleed into your joint longer than others after. So random story, I had an ankle sprain, a pretty bad one, but an ankle sprain. And it took me like 8 months to heal, because I didn't have factor. I wasn't even thinking about that at the time, right? Until later on, had the proper hematologist who's educating me on this. So I say that to say, because I've had a lot of like joint issues, and thinking about my future, I'm like, okay, now I understand this better. I'm more hopeful that I can help prevent some of those things going forward.
That's so good. Well, you're an inspiration to everyone out there who's learning how to navigate this matrix of challenges. And I like what Winston Churchill said: is never give up, never give up, never give up. There's got to be an element to it that do whatever you can to learn and to self-educate. Make certain you're getting your information from the right sources, and also make certain that you really just keep a positive attitude. They say with a lot of cancer patients that the number one commonality between people who survive it and don't is really a optimistic perspective and a will to live. And I think that that's something that's really important, even for people living with bleeding disorders, is that we need that sense of optimism. And I get that a lot of times from moments like this, meet other people in the community that are living, and navigating those challenges. It's not really about, how significant each hardship is, as it matters how much you link arms with others and continue to push forward and go through it. And you're a great example of that, Ashley. So thank you for joining me for this conversation today. Thanks for sharing your story, and thanks for your courage to keep facing the future, because there's a lot of decisions to be made for all of us. But I'm hopeful, just because if you're doing it, we can do it. I can do it. My daughters can do it. Our community can get through it, and together we'll make it through. So thanks so much, and great to see you today.
Yes, thanks for having me. Appreciate it.
Awesome. We'll see you soon. Well, big thank you to Ashley for joining me today. That was such an incredible story. I hope you got a lot out of that. You can post comments, and me and Ashley and our team will be taking a look at those to help ask any questions that you might have in this interview. Also, just want to remind you, you can join Ashley and me and a whole community of folks living with von Willebrand disease to be able to ask more questions about this topic and many others at our Advancing von Willebrand's Management Conference coming up just around the corner on July 16th. And all you have to do is go to our website and type in hope-charities.org, and you'll see it right there on the homepage. It's a free event. There's no obligation for anything for you to attend this. And we love generosity around here at Hope. So we're going to have tons of fun with giveaways and prizes and raffles and all kinds of things in every session. And you'll get to meet tons of people from all over the country, just like Ashley, who've navigated the challenges of living with a bleeding disorder. You can if you have any questions or anything, you can email us also at events@hope-charities, and we'd love to address any questions that you might have in regards to this event or anything else that we can do to help you. It is really, we consider it such a great joy to be able to do what we do every day to serve patients around the country in all 50 states with rare bleeding disorders and chronic illness. So thank you so much for taking the time to watch this. I hope that you found it valuable. If you haven't liked and subscribed yet, please do that. That helps out the algorithm. Remember that this content is important to you, which may mean it's important to your neighbor and your friends. So thanks so much for joining me today. And I certainly hope to see you at the upcoming event right around the corner. And till then, we'll see you very soon. Take care. Bye now.